welcome to this joint book launch and discussion on the findings of two books which were put out by the International Association of the Centers for Federal Studies and the Forum of Federations, looking specifically at issues of comparative federalism and their response to the COVID pandemic. The books respectively are titled Federalism and the Response to COVID-19 and Comparative Federalism and COVID-19, Combating the Pandemic. We have here today, as part of this discussion, a very distinguished panel drawn from all over the world. Let me start by introducing Professor Francesco Palermo, who is the president of the International Association of the Centers for Federal Studies. With me, he would introduce today's events. But in the meantime, let me also introduce our distinguished panelists, starting with the moderator this morning, Felix Knudling, Vice President and my colleague at the Forum of Federations, Professor Laura Flamon, Research Chair at the El Colegio de Mexico in Mexico City, Professor Eva Maria Besler, Professor at the University of Fribourg in Switzerland, Zemelek Ayele, Associate Professor at the University of Addis Ababa and Director of the Center for Federalism and Governance Studies, Professor Rekha Saxena, Nico Statler, South African Research Chair in Multi-Level Government, Law and Development. As we're all aware, the pandemic has clearly raised questions about the effectiveness of governance and response to crises, not just in federal and devolved systems, but all over the world. This touches on issues such as the roles and responsibilities of various orders of government, the adequacy of existing institutions and processes of intergovernmental relations. Furthermore, there is also the issue of whether the pandemic has led to innovations in federal practice, and thus whether federal countries are now better equipped to handle public health and emergency crises of these kinds. The forum certainly in its survey of 24 case studies aimed to develop an understanding of how a variety of approaches that we have seen across the world reflect the diversity amongst federations, including in their politics and institutional structure. But it seems to us that there will be some enduring questions that arise once the pandemic is done. We're now in the third calendar year of the pandemic. Perhaps there's an end in sight, perhaps there isn't. But we've learned a lot over the course of the last 2 years, not just in terms of the medical side of dealing with the pandemic, but also in terms of understanding institutionally and in terms of public policy, what has been effective and what has not. So I certainly hope that this discussion today will not only reflect the various trends that we see in different parts of the world, but also will set the stage for identifying future avenues for of policy studies and also with practitioners. Thank you very much, and I turn over to Francesco.
Thank you, Rupak, and a big welcome also on my side to this interesting book launch and presentation. Well, the books are certainly very interesting, and I'm sure that the presentation will be as interesting as the content of both books. I just want to make two initial points in welcoming all of you to this panel discussion. The first one is about the cooperation between the Forum of Federations and the International Association of Centers for Federal Studies. Both have been born in a way as two legs of the same body, one more political, the other more academic, but the general aim of both organizations is the promotion of federalism. In the past years, perhaps there have been a bit less opportunities to cooperate than there have been in the past. And in recent times, not only due to the pandemic, but for many other reasons, this cooperation has revamped. It has taken place on a more regular level, which I believe for sure from the side of the International Association of Centers for Federal Studies is a very welcome development, and we are very, very happy that so many opportunities are being realized. And the second point I would like to raise is about the very consequence of the pandemic. Of course, I don't want to sound ironical or cynical, but certainly the pandemic has, unfortunately, I would say, become a sort of an extraordinary opportunity to reflect, as Rupak was saying, on governance as a whole, and on federalism in particular, being a very peculiar way of organizing public power. The fact that federalism has been brought under the spotlight, not necessarily always in a positive fashion. There has also been a sort of a rhetoric very critical against federalism, but nevertheless, being paid more attention also in the public discourse is per se positive, because the real problem that federalism sometimes is facing is not a lack of efficiency, but a lack of attention. So if now the pandemic has forced all of us to reflect more deeply on federalism and its pros and cons, the potential of federalism will emerge anyway. Having said that, I will just pass the floor to Felix for moderating this event, and very much look forward, as all of you, to the discussion that will arise in this presentation of the books. Thank you again for this opportunity.
Thank you very much, Francesco, and also Rupak, for the introduction to this webinar. Just to follow up on what Francesco just said, obviously this is the occasion of this event is the launch of the 2 books, but it's not just about celebrating ourselves as organizations and individuals who've compiled all this very insightful and interesting knowledge, but also to kind of take stock in terms of where we are, and also to look into the future. And Francesco, you've mentioned the collaboration between the 2 organizations, associations, and us as a group of researchers or individuals who are interested in the issue of federalism. The purpose also is to have a discussion about what are the gaps. We've learned a lot, as you two said, but there are also still a lot of unknowns, and I think this is the objective of today's webinar, to discuss the way forward in terms of comparative and hopefully collaborative research. Now, we have a very tight agenda. That is the beauty of webinars, is we can all gather on short notice, and it's a very efficient way of meeting, but there's only so much time you can spend in front of a screen without losing attention. And we've a group of very distinguished experts, and what we thought we would do is each of the experts will cover a set of questions looking not just at the country they've written the various chapters for the books about, but sort of more comparatively what happened in the region their country is based in, and we're aiming to covering the whole world, and then trying to identify, as I said the gaps. So we'll have a very wanted to give the opportunity to the audience to raise questions. So for those in the chat box, and for those who've signed up for the Zoom call, you may want to use the Zoom Q&A function. So I would like to pose the first question to the group, which is from your perspective, what are some of the emerging federalism dynamics of COVID management in your region in relation to vaccine rollout, reopening of the economy following the lockdown? And do these differ to those in the early stages of the response to the pandemic? Both our books, of course, particularly look at the year 2020 and sometimes past till then. So we'd like to start in the West with Laura. Laura, the floor is yours.
Thank you very much for inviting me to this very challenging and interesting conversation regarding the Americas in my case. And I would like to start saying that I'm going to concentrate mainly in Latin America because the dynamics of the North and the South America are very different, although I'm going to talk about Mexico as well. So I'm roughly in the middle. So I'll start saying, trying to set the floor regarding how huge this problem of COVID has been for the Latin American region. And to start with, I would like to say three very short things regarding COVID management in general. The first is that we can pretty much say now that no country in the world was prepared for this. And we can, of course, discuss that. Second thing, it has been a very long pandemic. So pessimism has become dominant. Rates for governments and for executives. And of course, other matters have come to the fore, and thus the pandemic, although extremely important still, has lost steam in the public attention. Things like elections in the Latin American region, inflation, that's globally, and for example, in Argentina and in other countries, the in terms of the region, Latin America has been badly hurt by COVID. I would say that it's probably, together with North America, the two worst hit regions in terms of excess mortality. We can take a look at Mexico and Brazil in particular, but also the US. Lockdown measures in Latin America were extremely strict. We can take examples of Argentina, Chile, Peru. Overall, the mobility in Latin America compared to North America was reduced 70%, which is huge. And the global the economic hit was also terrible. In 2020, the GDP overall was reduced by 3%, roughly. In Latin America, GDP was reduced by 7%. So how can we explain this? There are at least three factors that I would like to stress. The first one is that the structure of the economy in Latin America. As you know, is mostly dominated, roughly 60% of employment comes from the informal economy. The Latin American economies rely heavily on international tourism and what has been called contact service sector. So it was very difficult to keep the economy open at the very beginning, at least in 2020. The other factor that has influenced the very terrible performance of the Latin American region regarding COVID has to do with weak states, in particular weak social security or a weak welfare system. We have very rarely universal social protection, not to say universal health. So that has created huge problems for the poor people in the region. And finally, the way in which the fiscal stimulus were constructed. Just to give you one piece of information, if we compare the lost output with the spending of the countries, in the US, for example, it was 1 by 1. That is, $1 lost in output was compensated with $1 of spending. In the Latin American region, that was 28 cents of spending per $1 of lost output. So in reality, Latin American governments have reacted very weakly to the huge problem imposed by COVID. In terms of federalism, and I'm about to finish, I would like to mention only 3 things to start. Governments and the regions within governments have reacted with lots of variation. We've seen heterogeneity. The most apparent problem for me, in my opinion, it's lack of coordination. We've seen confusing public messaging between different levels of government, especially regarding the use of masks, testing, and the array of policy tools in use have been very diverse. And I'll come back to that in the next segment. Thank you very much.
Thank you very much, Laura. This was very insightful and concise. We're moving a bit towards the east. Eva Maria, over to you about the experience in Europe.
Thank you very much, Felix. Hello, everyone. Yeah, I think the responses to the coronavirus pandemic has, as Rupak and Francesco have mentioned, thrown an unexpected spotlight on Europe's federations. I mean, federalism was rarely discussed in most federations. Countries like Austria and Germany and Switzerland only discussed federalism when there was a federalism reform on the table. It was mostly considered a dusty, outdated form of governance, sometimes cherished, but most often deplored for being slow and cumbersome. Now, all of a sudden, everyone is interested in federalism. Sharp increase in power-sharing systems. The mentioning of federalism in the Swiss media data bank has quadrupled between 2015 and 2019 and 2020. So in this regard, federalism and COVID-19, it's a great success story. It has helped people to better understand the system they live in and to all of a sudden care about the right mix of diversity and unity. Who decides, who implements, who pays, and why is that not always clear? The same debates have been very present and are still in numerous other federal systems of Europe, the quasi-federations, the regional states, and the devolved and the decentralized states, Italy, Spain, the UK, and the European Union itself. But even unitary states have discovered a new interest in regionalism and subsidiarity in actions and measures which are tailor-made and specific to regions, discussed and negotiated with regions, coordinated amongst regions, and have come up with territory-based traffic light approaches and the like. So proportionate action, lawful action, adapted to regional situations have been discussed all over Europe, basically no matter what the original organizational structure of the state was. But in this regard, federal systems have been in a definite advantage because in the regions, they were institutions and decision makers and law implementers ready to take over. So that would be my first point. My second would be that most European federal systems have not only gone through waves of infections, but also through waves of centralization and decentralization. Most have started to react to the pandemic on the local and regional level. And as it became clear that the pandemic was not to be contained locally, the reaction, mostly a panic reaction, was one of nationalization. Centralization internally, decentralization externally. So concentration of power in Europe's capitals. I think we still have to find out what that means for the future, whether it is weakening, regionalization and Europeanization, or whether we will find a way back. So this year, I think most European federal systems and the European Union have found a new equilibrium. In most countries, vaccine rollouts have been organized according to federal rules. Federal planning, regional fine-tuning, and regional implementation. Another federal dynamic in Europe, but I think it's a global one, is that we have newly learned the old lesson that money matters, and it matters more than what the Constitution says. If you're affluent enough to throw in money into the system and to ease the burden of a lockdown economy, you have to say. I think in most countries we have experienced that everything we know about fiscal federalism does not really work in a pandemic. And I think it will be extremely important to analyze this and to find a way back to more fiscal accountability and to a better match between competences, spendings, and duties. I'll leave it here. Or a final point, economically, it seems that European countries can take it. Most are already in the process of recovering economically.
Thank you, Maria. It was a nice contrast to Laura's intervention, different experiences here. Over to you, Zemlak. Africa. Very much looking forward for your intervention.
Thanks so much. Nice to meeting everyone. I was asked to speak the federal dynamic in Africa in relation to COVID. First, let me say, basically everybody expected the worst will happen in Africa when it comes to COVID, but relatively, it seems we fared much better than the rest of the world. The report indicates that there were some 10 million infections from about 1.2 billion people in Africa. And the death rate was some 250,000 in Africa compared to what was going on in the USA and other parts of the world. I think it was much better, even though still regrettable. Of course, there are differences from countries to countries. South Africa was hit hard and the other countries fared much better. Why was this the case? Is something that requires its own study. But the economic impact of COVID in Africa still needs further study, but it was felt especially by the poorest of the poor of the continent. When it comes to the federal dynamic, the impact of COVID on federal countries in Africa, when it comes to that, in the chapters in the book were Nigeria, Ethiopia, and South Africa, but we also consider Kenya to be part of those federal country or quasi-federal countries. Somalia, South Sudan, Sudan to some extent are kind of either quasi-federal federal countries, but they were not covered in the study. Now, of course, there is difference in design, in population, in economy, in political history of the federations. I mean, Nigeria, Ethiopia, and South Africa. But there were some similarities in the way that they dealt with COVID-19. And I call this not a federal dynamic, rather unfederal dynamic, because they acted not in the way that a federal system is supposed to. There are for the federal government and subnational governments had some competence with respect to dealing with the pandemic in the form of declaring a state of emergency or exercising concurrent power with between federal government and state government and the like. this was seen in all the three countries. The other issue was in the early stage of the pandemic. The reaction from the subnational government, waiting for the national government to take charge. This might be because the pandemic was something imported and the federal government was in charge of controlling who can enter into a country and who can leave the country. At the later stage, when it comes to, for example, ordering lockdown or declaring state of emergency, again, the central government took charge and there was a lot of centralization of power. It was the case in South Africa, and it was the case in Ethiopia, and it was the case also in Nigeria. And later, when vaccination rollout started again, the central government took the lead. This might be because one thing, the vaccine was donated by foreign countries, and it was the federal government which was negotiating those with international communities, and and subnational governments were basically unable to purchase vaccines. So it was the federal government which was in charge. Do I have time?
You have 1 more minute.
Okay. So subnational governments, provincial, state governments were specifically about Ethiopia. It created opportunity for the federal government, the federal system to come in one of the states, the Tigray state, in the federal government regarding whether or not a subnational government can hold its own election and whether or not the subnational government can declare a state of emergency, and whether or not the federal government state of emergency would prevail over a state of emergency by a subnational unit. Those issues were not, however, to war. Let me stop here and I'll come back with the other points later.
Thank you very much. Hear this, I think, saying this from a Western perspective, that us. So thanks for stressing that, but I think it's an interesting point. Rekha, over to you. How was the experience in your region?
Yeah, okay. Thank you. Good morning, good afternoon, good evening. Well, I think the federal dynamics, not just in India, but all over the world, had to face, and I would say still face challenges, I think, would define center-state relations in dealing with the pandemic efficiently. So in that context, in response to the onset of COVID-19, the central government in India implemented one of the most stringent lockdowns in the country, especially in the first phase. And this was done, without consulting the constituent units of the Indian federal setup. And further, there were multiple pan-India directives concerning lockdowns in the first phase that, encroached upon the jurisdictions of the states, like industry, shops and market, agriculture, state government offices, etc. And central, directives after directives, they had to be. The economy opened after the first phase. Interstate and intrastate trade and commerce, that was not much affected. Now, similarly, as far as the vaccine drive is concerned, the central government issued instructions to state governments to initiate, rollout after consulting the center. And there was an expert committee which was also set up on vaccine administration, and states had to adhere to its directives. So I think such instances in the both first and also the very devastating second phase did, appear centralizing most of the times. But I would say it was essential to ensure some kind of the pandemic. Moreover, at various levels of governance, like district, city, village, many initiatives, models, and drives they were launched, like Bhilwara model, Agra model, Kerala model, Dharvi model in Maharashtra, Mumbai. Although in line with center's guidelines to fight this COVID-19 outbreak in the states. However, today, I would say, as India is currently undergoing the third wave of COVID-19, think in terms of the federal response to this situation. Because I think the states have more leeway in implementing their that in the line with the fact that health is a state subject in India. States are effectively, carrying out vaccine drive very independently. And shops, markets, they have greater autonomy to issue their own, guidelines like opening of shops on rotational basis, or no restrictions at all, or weekend curfews in some states, and also entry with regard to COVID negative report while crossing one state to another. Further, I would say additional autonomy has also been given in this phase, extended to the states in the third phase issued by the latest guidelines, by allowing the states to decide about quarantine measures for international travelers. So I would say these are the differences that I find, during the different phases of COVID. Thank you.
Thank you very much, Rekha, and to the group for sharing sort of an initial reflection on the experiences in your region and delving a bit more into detail from your perspective. What were the factors that determined either the effectiveness or the ineffectiveness of federal governance or federalism in terms of response to the pandemic? We start again with Laura. Over to you.
Yes, thank you. Well, in the previous section, I stressed the fact of variety of responses, heterogeneous responses in the region. So just to illustrate that, I'll start talking about 3 countries. Argentina, which was pretty much a success at the very beginning, but then it became a failure. And Brazil and Mexico, which overall have shown a failed management of the COVID crisis. Probably what I would like to stress is that in the Latin American region overall, what we've seen is an amplification of weak governments. Specifically, as you well know, Latin America has the most unequal federations pretty much all over the world. In terms of GDP per capita, if we compare the GDP per capita of the regions within the countries and bureaucratic capabilities. So I would like to point to 3 things that I think deserve attention, trying to explain the overall inefficacy of the federal governments in Latin America to face the COVID crisis. First one, it has to do with the federal architecture. What we've mentioned before, pretty much very centralized federations in Latin America, very weak in fiscal terms. The second factor has to do with the capacity of the different levels of government. And overall, we have countries in Latin America with low capacity, although there is variation across the regions within the countries. And specifically low capacity regarding essential services in the subnational governments. Things that have to do with health, with education, and with simple things like waste management. In terms of health, for example, we have very different resources available for testing, even to process testing. And we've seen overall, and if we have time in the Q&A section, I'd like to talk about this. We've seen a very specific group highly affected by the pandemic in Latin America and pretty much all over the world, which are females. So we're lacking gender perspective in the response to the COVID crisis overall. The third thing related to federalism has to do with the relations, intergovernmental relations across the different levels of government. And I would like to stress failures in communication and lack of cooperation, and of course, lack of coordination. That overall is a trademark in the region. Also, at the very beginning, Argentina showed a different phase in terms of cooperation, being able to draw from the recent election of President Fernandez and his political capital and the political capital of his political party. And I sense a lack of understanding of what cooperation means across subnational governments. Just let me give you an example. Last year, in October last year, I had an interview with a high-ranking health official in the federal government. And I was talking to him about the lack of coordination, and he kept insisting, well, I was constantly on the phone with the governors. So of course there was cooperation. So he seemed to not understand what real institutional cooperation means. And just to give you an example of this, what we've seen in both Argentina and Mexico is a very little influence of a policy of the health federal councils. So even though these figures are in place, pretty much they didn't play any role in deciding the policy activities of the national governments. So in the Latin American region, without clear federal guidelines and standards to manage the crisis, I think the federal government lacked in that regard. State governments or subnational governments have reacted unevenly, deepening social inequalities. The result was that isolated decision-making, disconnected fluxes of information, and uncoordinated actions all deepen public uncertainty. Because relatively affluent subnational governments, subnational regions have more capable governments and more robust health systems, the populations have been protected more effectively than those of the poorest states or provinces. In the case of Mexico, for example, this may explain the much higher fatality rate in poorer municipalities than in richer ones. Thank you very much.
Thank you very much, Laura. Lack of coordination, lack of collaboration between levels of government, horizontally, vertically. Eva Maria, is this something you observed in your region as well?
Yeah, definitely, absolutely. But I find it hard to determine the factors determining effectiveness, because it's hard to decide what effectiveness really is. And I think it is important to keep in mind that most factors probably have nothing to do with the government structures, but density of population, situation of the health system, and a lot of factors which are not related to the government structure. Overall, I think the pandemic has brought all the institutional weaknesses to the fore that most countries knew about and were able to cheat through in normal times. But in emergencies, all of a sudden, it no longer works. So I think few countries have discovered new weaknesses, but have just realized how much a problem the old were, or like weak intergovernmental relations in Italy, unreasonably small units in Switzerland, a highly unitary system in Austria, a very divided federation in Bosnia. So I think most countries have realized that it's the time to do the homework, that countries were postponing and now have come to the fore with a lot of urgency. I think preparation has made a big difference. Some countries had better constitutional and legal frameworks, had better institutions in place and processes to speed up decision-making. Some have been very unprepared, including practical issues as digitalization. Can you make joint decision when you cannot physically meet? In my country, most parliaments were absolutely not prepared. So members of parliament just went home and did homeworking and had no access to electronic decision making. So I think knowing better before who should make decisions and implement them when there is little time would have helped. And I think when you mentioned capacity of different levels, I think one of the lessons is that even though you're tempted to shift competences and duties around and you probably shouldn't do it too much, because in times of stress, most individuals and institutions should do what they do best, and that is what they usually do. If all of a sudden central administrations take over in federations, usually they have little to do with health. The federal officials in my country have never seen hospitals from the inside, except as patients. Now, if all of a sudden they do health implementation, it goes very wrong. So I think a real factor of success is to increase the resilience of institutions you have. And if you have to centralize, bring those regional people to the center and don't charge of institutions with tasks they have never done before. I'll leave it here.
Thank you very much, Emanuela. Zemalek, over to you.
Okay, thank you, Felix. I'm not sure if the countries were effective or ineffective in terms of dealing with COVID and pandemic, but we can say that they were not effective in terms of dealing with COVID-19 as a federation, as countries with federal system, and we can give a different reason for that. The first, maybe with the federal architecture of the three countries, matters relating to health seem to be concurrent powers. And as is the case, for example, in South Africa, subnational government's decision or law can be superseded by laws or decision of the national government. So that I think allowed the federal or the national government, and the case maybe, to take the lead in terms of dealing with COVID-19 and to undermine any effort coming from the subnational government. The other maybe lack of clarity in division of power. For example, that was the case in Nigeria. For example, the issue as it is explained in the chapter in one of the books. One of the issue was, is COVID-19 a natural disaster or is it a health matter? If it is a natural disaster, it is a federal competence. If it is a health-related matter, then it is a state competence. And who has the competence to deal with COVID-19? That was, for example, an issue in Nigeria. The other, I think it is kind of a universal challenge. Eva Marie has also mentioned it, the financial dependency of subnational governments on federal government or national government. Since the federal government has the money, it was able to dictate what the subnational governments could do or should do. The other one, as I mentioned earlier, is the global nature of the pandemic itself. It is something imported from other countries, and the gatekeeper is the federal government. So the subnational governments were just waiting for it to take the lead in terms of preventing the pandemic from entering into the country. So their role was supposed to be only after the pandemic or the virus was introduced in the countries. Incompetence and corruption, of course, was a reason for some ineffectiveness. For example, Nico has stressed this issue in his chapter on South Africa. For example, the incompetence in Eastern Cape, how that led to a disaster in that part of the country, even allowing the virus to spread in the rural areas. The other issue may be the absence of federal culture. For example, in Ethiopia, I think that is the case. Despite the fact that we have a federal system, a federal constitution, we have been governed like a unitary state. We didn't have a federal culture. So that didn't allow us, I think, to deal with coronavirus as a federation. The last 2 points are sidelining IGR forums. That has been the case in South Africa, for example. The National Coronavirus Command Council, which is established at the national level, was taking charge of everything, and it was highlighting the provinces. Also in Nigeria, the National Emergency Management Agency, which was exclusively composed of federal ministries and agencies, was dealing with the virus without involving the states. In Ethiopia, there was no even IGR structure to speak of in the first place. So these are some of the issues or the factors that led the countries not being able to deal with the virus as a federal government, as a federal country should do. Let me stop here. Thank you.
Thank you, Zamalek. Surely some issues that we've also seen in other parts of the world. Rekha, you have the floor.
Yeah, thank you. So I would say that going by India's experience, it's safe to say that only cooperative federalism is the way forward in dealing with such a pandemic. And cooperation, not only vertically, but also horizontally, not just between center and states, but also between state and state. Hence, I would say that multi-level federal COVID-19 management model and its efficacious implementation, that's the best response to this pandemic. Further, I would say frequent federal dialogue, that is very essential to strengthen cooperation, like the periodic dialogues between center and state, that is very much needed to boost, a health sector in the country uniformly. And this executive federalism has been at its best during this pandemic period, and world over, and especially in India, especially through video conferences that Prime Minister held with chief ministers of different states and lieutenant governors of union territories in all the three phases. Of course, there has been centralizing trends in the, as I mentioned, in the first phase, and then they were relaxed in the second phase and the third phase. Furthermore, I would say that any federal response need to realize that without health sector strength and efficiency, we cannot overcome this pandemic. So health has to be, there has to be more, budget for health, in the budget and next budget. As compared to other countries, it's education and health. That should be the primary responsibility of the public sector. So I think that has been, now the Indian state has realized that after the pandemic situation. Besides, I would say that the most important factor in this regard is also concerning fiscal federalism. Undoubtedly, this pandemic has taken a severe toll upon the economies of the nation, but within the federal system as well, particularly in context of India, state governments, they have enormously suffered economically with continuous fall in their gross state domestic product due to GST, goods and gross state GDP, gross state domestic product, due to the centralized restrictions which were made on interstate and intrastate trade. Therefore, I think it's the responsibility of the center to timely release disaster response, like PM care funds to states, and also relax norms relating to borrowing from center, because and this should be unconditional, and timely release of goods and services tax compensations to states, because there was bad tax collection, and so the borrowing limits of these states have been increased from 3% to 5% of their GDP, but only 0.5 is unconditional, whereas rest of the borrowing is depending on states' initiatives in introducing reforms in areas such as power sector, urban development, job creation, etc. So states' capability to borrow should be unconditionally strengthened. And finally, I would say that there's also a need to have regular, conduct of GST Council meetings, which is an important intergovernmental forum, which represents the states also, and also make use of constitutional forums like Interstate Council, which has not been done, and both center and states, they have been making use of informal forums like chief ministers' conferences and conferences with ministers, secretaries. So why not make use of constitutional forum like Interstate Council? So that should be the way forward in what constitute an adequate federal response to the ongoing pandemic. Thank you so much.
Thank you very much, Rekha. Now, after this sort of tour d'horizon about experiences and lessons based on the books and the research that you've done and that you've read to prepare your intervention, in terms of the gaps that we mentioned in the beginning, from your perspective, where should we go forward in terms of generating more knowledge or going a bit deeper in terms of the issues you've identified that helped or did not help in terms of pandemic response, and how federalism played a role there? Laura, let's start with you again. You have the floor.
Yes, thank you. Well, I'll be very brief, so we have time to talk among ourselves and answer some questions. And I would like to point to 4 things. The first one, of course, has to do with we need to learn more about coordination, how to strengthen the mechanisms of negotiation of federal affairs. I think that's very important. The second thing is how to strengthen, and we need to find out more about bureaucratic capabilities. So in several Latin American countries, we either don't have a civil service, or we have very weak civil services, both at the national and subnational levels. So that's something important to study bureaucratic capabilities. That's the second thing. The third thing has to do with the judiciary, the judicial power, and how it has become the referee between national and subnational government in several countries. One example is Brazil. And these disputes that are brought to the fore in the courts bring uncertainty to the process, because of course all judges have to interpret the law in an environment in which information is not clear. So going to the judiciary may add uncertainty. We need to learn more about that. Finally, I think it's very important, and that applies not only to federal studies, but to science as a whole. We need to prepare for the next pandemics. So we have to talk about the fiscal weakness of national and subnational governments. Things as simple as purchasing supplies became a big issue in several countries, in the US, in Mexico, in Argentina. It wasn't clear who was supposed to purchase supplies, such as testing or even masks at the very beginning. And that had an influence in the directives of the federal governments. Recently, in the US, Dr. Fauci recognized that the idea of using any kind of masks is good at the very beginning, had to do with not having enough masks overall. So I would point to those 4 things: coordination, bureaucratic capabilities, the judiciary, and pandemic preparation.
Thank you very much, Laura. Very concise. Eva Maria, if you had a huge grant for federalism research, what would you do? What would you look at?
I keep applying for such grants. In a way, I would just like to subscribe to Laura's list. I fully agree. I think federalism under pressure, federalism in times of crisis, we don't know how to do it yet. And we better use the lessons we've been able to make to prepare for next crisis. I think most of the systems we have, they have rules on emergencies. They know who can declare it, and who can decide. But I think none of the countries is prepared to deal with such a long and all-encompassing crisis, which is not a health crisis, but it's general governance, economic, societal crisis. So most countries would have in such situations concurrency. And we know how to deal with concurrency in normal times, but we cannot do a concurrency under stress, because it relies on a system where you have shared rule that you design jointly, your second chamber comes in and consultation comes, and then regions or provinces can come in with fine-tuning and complementary rules. Now, all of this doesn't work in a pandemic. So concurrency has to be redesigned for stress situations. And I think we also need rules to deal with negative conflicts. At least in my country, that was a new discovery. You know how to deal with 2 actors both wanting to act in conflicting ways. Now we had a situation where none of the levels wanted to issue lockdowns or any other costly measures, hoping for the other to act. So we have lost precious time. Another big field of upcoming research is, or coming back, is the federalism and democracy, federalism and the rule of law, and federalism and human rights. Because I think we have underestimated how much it does to other constitutional value when we start fiddling around with competencies. If all of a sudden you have centralization, you miss an important element of your checks and balances. If power goes to the national government and parliament loses influence, so do the subnational units represented in the second chamber. Human rights, I think, are central. Restrictions, we all know, according to national constitutions, international law, must be strictly limited to what is necessary. Now, usually we think in terms of content and time, but we must get used to think about territory as well. We probably need more territorial flexibility in all states to meet human rights requirements. And I think that is a new field that we should tackle as researchers. My last point, and it's the one closest to my heart, is global federalism, global governance, because it has been such a frustrating experience to see that how selfish nations become. And we still see that. If we can talk about vaccine rollouts, but some countries don't talk booster, they're talking about the fourth jab, while in other countries, access to vaccine is still limited. Now, I just find it extremely shameful that a globalizing world is not even able to manage such a fundamental issue where we know we all depend on each other and deeply are interconnected. We cannot coordinate such basic issues. And I think federal tools would very easily be applicable to global governance. I leave it here.
Thank you very much for this this bottom-up approach, starting with a rather smaller entities in Switzerland and leading us to the global situation, if I may. Zamalek.
Thanks. I think the most important points have been touched by Eva Maria and Laura. I don't know if I have anything much to add, but my understanding is that the pandemic has kind of required us to re-examine everything that we know about federalism. Issues of power division, issues of fiscal federalism, issues of intergovernmental relation, all these have to be re-examined with pandemics and other disasters in mind. That is what I think. And the other issue, which is very close to my heart, and an issue that Eva Maria raised, is federalism and democracy. That is something, I mean, that's direct impact here in my country, and that is basically what led to war here in this country, and it's something that we have to re-examine, especially federalism, democracy in state of emergency, in case of pandemics, issues of postponement of election, or issues like that needs to be examined. This is what I think. The other issues have been already explained well by the two speakers. So let me stop here.
Thank you very much, Zamalek. Rika.
So I think many important issues have already been discussed by my co-panelists, but I would add to it this issues like impact of pandemic on gender and federal response to it, and executive federalism, as pointed out by Laura, strengthening, executive federalism and intergovernmental coordination, judicial federalism, fiscal federalism, in context of the pandemic will only add to the depth of the existing knowledge we have on federalism. Like, as we all know, that in 2020, in Australia was one of the federal countries that enacted, a new legislation to tackle with the pandemic. In India, the federal response was guided by the already existing laws, like Disaster Management Act, Epidemic Disease Act, 1897, then Drugs and Cosmetic Act. So I think research can be carried out, finding possibilities to enact new laws at both central and state level in dealing with the virus outbreak. Furthermore, I think inquiry over the role of judiciary, in ensuring cohesive federal response to the after effects of the pandemic, that can also be undertaken. Because, for example, in 2020, the Supreme Court of India had to intervene, in order to tell both the center and the states to ensure, safety of the migrant workers, the plight of the migrant workers. You saw very sad pictures all over Facebook, walking migrant workers walking long distances, and they had to leave the cities. So the plight of the migrant workers. So similarly, I would say that in order to deal with COVID induced after effects, it is also essential to have an inquiry about in what ways fiscal relationship between center and the states can be redefined with respect to unconditional fund transfer, adequate allocation, etc. And prospectively, a new dimension can be added in federal framework. And that is, and concerning vaccine and vaccine rollout in time of pandemic or epidemic. For example, in case of India, Drugs and Cosmetics Act 1940, that empowered the center to facilitate regulation of sale, manufacture, and distribution of any essential drug to deal with any emergent situation arising due to an epidemic. So how that affects the federal cooperation and collaboration. Yeah, so these are some of my observations. Thank you.
Thank you very much, Reka, before we go to maybe respond some of the questions that have been raised already by the audience, I wanted to take the opportunity as the discussion facilitator to follow up on a point that Eva Maria, you made in, I think, your first intervention on the renewed or strengthened interest in federalism as such that we can observe, and the flexibility that federalism has allowed in the response to the pandemic, and the advantages it may have in comparison to unitary states. And I was just wondering, and maybe I misunderstood, but do we actually know? I mean, we're discussing, of course, here amongst those who, someone said, I think Francesco was it in his introduction, promote federalism, and we work on federalism all the time. But do we really know whether federal countries actually performed better in terms of the crisis, be it in the health sector or be it in the area of economic relief? If you read the book that we've edited, which included one chapter that written by David Cameron that compared the performance of federal country versus unitary countries according to a series of indices. You may want to criticize the methodology, and he also recognizes it's to a certain degree superficial. But one of his preliminary conclusions was actually that governance probably doesn't really matter, because some of the best performing countries were federal countries, but there were also unitary countries, and some of the worst were federal countries as there were unitary countries. So are we actually sure that federalism really matters? I mean, that's a very basic and fundamental question, but it's something that I think we discussed also internally as a group of editors who commissioned all these country papers when we reviewed them, is that this is a question where the response probably still stands out. I mean, we're maybe able to identify the opportunities or the advantages that some variation of federalism provides compared to others, and the disadvantages, and we're able to, and even that is already challenging. If we know that we're not comparing apples to apples. I mean, each country chapter and each comparative book starts by pointing out and recognizing that all countries, of course, are unique and have their own federal structure. So already that is challenging to compare. But we're kind of intrigued by that as the form of federations, in that question is it possible to actually answer that question, and what would be the approach one would take? Because as we also discussed, there's so many other factors we would have to look at. I mean, political leadership, the economic background, the federal culture, the constitutional framework. If you mentioned the demography, which may play a role in Africa because it's a younger society. So many factors we need to take a look at, and it's of course a very complex question. So I just wanted to add that, and it's probably sort of more at the macro level compared to all the very important points you made on the nature of collaboration and coordination, and the need for looking at how federalism impacted on democracy and other important questions. But I just wanted to put out that broad question, and I don't know, whoever feels free to take the floor, please go for it. Eva Maria.
Sure, thank you, Felix, for the comment. We have been discussing it a lot, probably like you have in the forum. To me, the question is entirely open. It depends, as you mentioned, on numerous indicators. But to me, as a constitutional lawyer, I must also say, I don't care. Someone else should try to find out. What matters to me when we look at effectiveness is the effectiveness of constitutional values, and that's democracy. That's adaptability, flexibility, human rights, minority rights, participation, whether there are fora for learning, for debate, for consensus making. And that is what I look at. I'm not counting the death because I don't have the methodology. And I think the other aspects of governance are just as important, especially when we think about preparing for the next crisis, because the next crisis will be very different from the one we've just seen. It might be another pandemic, it might be global warming, what do we know, or electricity. So I still think our fundamental interest is, are we as societies able to produce legitimate decisions when our normal system is not working? And in this regard, I think that federal systems tend to do better because they have more fora, they have more space for experiments, and they have just a better consensus making and learning culture. Because if you would tell me that, for instance, China, at the end, when natural scientists have figured out how to deal with the many indicators, if they would come to the conclusion that China has dealt with the crisis in the best way, I would say, thank you. I still would not want to learn from those top-down lockdowns and human rights violations, I would say. That would be my comment.
Thank you very much. Anyone else? Rekha? Sure.
Yeah. So I agree with both of you, and that it's very difficult to come to any conclusion whether federal system or unitary system can do better because of the various indicators that both of you mentioned, and like demography, geography, culture. India is a very diverse society, religious, multilingual, multilinguistic, multi-religious society. There are deep cleavages. So it's very difficult, But I think the federal system has advantages because we have different tiers, levels of governments. And so government becomes more accessible to people. And even, in terms of supply of this vaccines and tests. And then we saw so many experiments, like Eva Maria mentioned about this multiple access points, that there's more space for experiments. So one, there were so many models in Kerala, they announced some fiscal package, state of Kerala, and that was replicated by the center. Similarly, many district administrations, they, models, like I mentioned, Bhilwara model, different state governments experimented different models, which was replicated by a center and also by different states. So they learned, it was a mutual learning experience. So because federal system provides multiple access points, and one level of government can experiment or innovate, and that can be at a lower level at the state level. If it is successful, then it can be replicated at the national level or by other states. So I think that federalism has that advantage. Thank you so much.
Thank you, Rekha. Zemalek, you have the floor.
Thank you, Felix. For some of the countries like mine, whether or not to adopt a federal system may not be an option. It may not be optional. Sometimes it may adopting a federal system may be a decision adopted for the sake of survival, for the sake of even existing as a country. So, and when we countries like mine adopt a federal system, like I said, it's not only optional. So what we should worry and what we should think about is about how to make it work, both in normal situation and when in abnormal situation, like when even when war happens, even when there is disaster, natural or otherwise. So sometimes it is not whether or not a unitary system is good or a federal system is bad. It is you have what you have, and it's about making it work. Just that's what I want to say.
Well, thank you very much. I mean, this goes along the lines of Eva Maria's and also Marika's intervention, and it's I agree. You know, it's that is in the end the key question. And you also, I mean, I think all of you mentioned the issue of the learning culture, and you know, the old approach in terms of thinking of federalism as a laboratory. And we tried in our book also to elaborate a bit on that, and to really try to find out whether learning existed in terms of you know, sharing good or best practices in terms of governance and responses to the crisis. But I think that's also an area where we need to look a bit deeper and find out whether this indeed was the case, because that would also be a point to saying that there are some important advantages to federalism. So let's move on to some of the questions. We've lost Laura, maybe due to connectivity issues. Otherwise, I'm sure she would have had input on that question too. So some of the questions we received also, I think, expand on or follow from what we've just discussed, and that is the question of bottom-up versus top-down, maybe also the question of the need for centralization in terms of crisis. If we start with the issue of centralization, as you all mentioned, that's something we've observed, particularly in the first month or two of the pandemic, and probably also that wasn't so much a surprise, because that's what historically also happened in other times of crises, that there is a tendency to centralize. But does this have long-lasting impact on federalism? What is your perspective? Laura, we have you back. That's good. So who wants to go first?
Can you clarify the question? I'm not sure if I understood the question.
So we saw, I think you all mentioned that we saw centralization in terms of, you know, the federal and national government accruing decision-making authority, particularly in the beginning of the pandemic. Will that have, from your perspective, long-lasting impact on federal governance in the country you studied or the region that you covered for your intervention? Eva Maria. Yes.
Yeah, we're probably all silent because we are asking ourselves the same question. I personally have no clue. I don't expect Europe's federations to profoundly change. I think the national governments have made so many mistakes that it's not that everyone thinks, what a relief if only central governments take over. I don't think that's the general perception. Most people would like to go back to normal life, and that includes probably normal partners when it comes to governance issue. I think the greatest threat, if that is a threat at all, comes from what we have done economically. It has produced so much debt at various levels and so much central guidance when it comes to bringing the economy back to operation. So I think that will be the hardest part to reverse, because that will stay with us for years to come. For the rest, I don't expect centralization to happen, especially as in a number of countries, decentralizing experiences have been as important. When we think of Germany, Bundesländer have taken over roles that they had not known before, including at some point closing internal borders. I think it has rather strengthened regional identities and connectedness with regional government actors.
Thank you. Yeah, similar.
Okay, I mean, the centralization in some of the countries that we covered here in Africa, it was not an aberration. It was rather kind of the normal thing here. Central government has been dominant in the politics of these countries. And the reason, like I mentioned, to some extent is because of the federal design. And most importantly, as also Nico has explained in his chapter, it is the political culture of the countries here. In Ethiopia, like I said, we had a federal structure, but we had a political system which was very much centralized. So there was a fertile ground for the central government to centralize even more when this kind of crisis emerged. The same story in South Africa and Nigeria. So I don't think there would be fundamental change in terms of how the federal system operates in these countries in the future. It cannot get worse, probably. There may be some kind of dialogue to re-examine how the federal system operated both during the pandemic and before the pandemic, and maybe some kind of structural, design change or whatever. But I don't expect fundamental change. That's what I want to say.
Can I come in?
Sure.
Yeah. So I think when it comes to maintaining federal equilibrium, I think it's imperative on part of a federal country like India with strong centralizing tendencies to sustain mutual respect between political structures of center and the states. And the current, pandemic turmoil has taken a toll on all aspects of life, not even leaving the federal aspects of the Indian Constitution. More than ever, since independence, it's indispensable for both, I think, center and states to deal with the current situation through coordination and cooperation. But final word, I would say that regardless of this division of roles and responsibilities, cooperative federalism, that's the real way forward. But at time of pandemic, center is bound to have centralizing tendencies, which in case of India, I would say, it's my personal opinion, is justified to a certain extent to have some uniformity in federal response, considering its vast diversity, diversity and vastness of the country. Thank you.
Thank you, Ulrika. Laura, from where you sit in the countries you studied, did you see a strengthening of regional identities or capabilities during the pandemic? To me, it sounded more, it was the opposite, but maybe you can clarify that for us.
Sure, Felix. What we've seen is the emergence of local autonomies For example, Mendoza in Argentina and Jalisco here in Mexico, they've called for a renewed fiscal pact or a strengthening of the capabilities of the subnational governments, the provincial and state governments. So we've seen that, and the lack of coordination and the confusing messaging that I was talking about also created problems regarding open political conflict. The Federal Health Ministry opposing some governors, or as in Mexico, or as we've seen in Brazil, the judiciary had to intervene in trying to solve conflicts between President Bolsonaro and some governors regarding lockdowns or other mandates, even vaccine mandates. And I had a technical problem and was gone for a few minutes, but I'd like to come back to the question you posed regarding how the federations did overall compared to unitary systems. And well, we all know that's a very challenging research design, because we would need to have the same country running as a federal country and as a unitary government as well, right? So that's pretty much impossible. So it's very difficult to tell. We have to come up with a very clever research design. But also, and I think you also mentioned this, it's difficult to say that all federations are the same, right? We have such a wide range of different bells and whistles of each federal system that it's difficult to say that all federations are the same. There's as much variation as when we want to compare presidential and parliamentary systems. I think it's pretty much impossible. And as Eva and Veka and Sanek were mentioning, there are so many other factors influencing the way in which governments have reacted to the health and economic crises related to COVID. That I think it's not a worthwhile endeavor to decide if it's the federal organization or the unitary organization that explains the performance of the countries regarding the crisis.
Thank you very much, Laura. So if we agree that, or maybe not agree, but see that comparison between federal and unitary countries will be challenging methodologically, and we stick to comparing federal countries. There's one question that from the audience that I wanted to put forward, and that is, could there be a universal formula? If there's a global problem, can there be a universal formula that federal governments can follow, or does it always have to be context specific? It's a question posed from the audience to you. Who wants to address that question? Sure, Reka, the floor is yours.
There cannot be a uniform formula, because every federal system has its specific context, historical context, cultural context, geography is different, diversity in terms of demography, geography. So I don't think there can be a universal formula. Thank you.
Yeah. Zamalek, floor is yours.
Let alone a universal formula at the global level. I wonder whether there could be a formula applicable throughout a single federation. There must be even the context has to be considered even at subnational level. That's why we have a federal system in the first place, because even within a country there are variations in terms of culture, demography, and the like. So. Despite the fact that the challenge is global, I don't think the response could be kind of a single framework at the global level. Thank you.
Thank you. I think there's agreement on that.
Can I just add to what my colleague said? He made a very interesting point that it's not only about federal countries, universal But within nation, about the subunits also, one size fits all cannot be applied. So that is a very important point that you made. Thank you.
Yeah. I think that that there's consensus almost on this question. We can all learn, but in the end, solutions have to be context specific. With respect to the time, I would now like to invite Nico Stadler to join our panel. Nico's followed the discussion very intensively. Nico is editor of one of the books that we're presenting today, of course, and longtime friend of the forum and, of course, member of ICFS in his capacity as the South African Research Chair in Multi-Level Government, Law and Development, the Dulomar Institute of Constitutional Law, a University of the Western Cape. So, Nico, we discussed you would follow the discussion, and it's always difficult to summarize and synthesize, reflecting so many views and experiences in such a short time, but with a view of the findings that that you gathered in the book and the reading of the work we did and following the discussion going forward in terms of key questions, be it on constitutional issues related to democracy. I think that was very much emphasized by the panelists, and also the questions of performance, and of course also how to make sure that next time we as people who live in federal countries are maybe better prepared. What's in terms of research agenda, what are the key takeaways you took from the discussion? Floor is yours, Nico.
Thank you, Felix. And let first with a word of thank you for you with this great initiative to bring the two books together. It just, as Francesco and Rupak said, it cements, I think, further the collaboration between IACFIS and the forum. And also there's a nice overlap between authors that wrote in both books. So it's a real organic presentation of the facts. But also recognizing it's 2020, now we on 2022, and the urgency of the matter, I think we need to address first. Just on the emerging federal dynamics, and what we also hear, I think there is a real fundamental change taking place in the pandemic, a number of factors. We've got a new variant, Omicron, more infectious, but less lethal, less severe, which also allows people to rethink of how we're going to live with COVID, that it is going to be part and parcel of our lives. And that goes in with the second factor is this high level of public tiredness about COVID and the attempt to lead normal life, so desire for normality. Because we've now into vaccinations, and whole debates is now consumed about controlling access to public and even private institutions with vaccination or not. And so there, I think with more knowledge, less fear, I think rational choices are going to be made very much more better. If the differences between what happened in the first year and what happened in the second year, we see, I think, much greater mixture of approaches. Severe lockdowns in Europe and Australia, in wave after wave, more and more lockdowns. While it didn't happen in Africa, North and South America and India. So a real difference there between approaches and whether the lockdown was in fact the way to go. But we also seen then over the past 2 years, this waves of lockdowns, but the role of subnational governments. How, in fact, it changed and brought them to the fore, and then again put to the background, and we have a very fluid system to tell. What can we tell now definitively? I think it's difficult because we are still in it, and so the full picture is still to be emerged. But what also happened, I think, was at the beginning an acceptance by the public of, government knows best. We've got a much greater public awareness and demanding accountability. We can just see, even in the UK, Boris Johnson's job is on public demand. How can you have this? And this brings forward governance. One rules apply to all. Even if you're the greatest tennis star in the world, you follow the rules in Australia, which is accountability, which I think is because people could understand and experienced this pandemic and the rules that were made under it. Your second question, I think, provoked very interesting answers and comments by our panelists. How effective was federalism? And is it the correct question to ask? Whether it was better or worse. And I started off the volume with IACFIS with a question: is federalism a boon or a bane? And in the end, it was a too simplistic question. It is not going to be answered. But what we can see is that, to my knowledge, federalism has not been given, or wasn't seen as the scapegoat for federalism per se. And in many cases, it showed real value. It became a check and balance in the US, in Brazil, and even in Mexico, where there was, in fact, the subnational government coming to the fore as a check on wayward federal governments. And in that, it has also boosted federalism as a way of governing well. In Scotland, the First Minister, Sturgeon, came out much better than a counterpart, Mr. Johnson, as strengthened the notion of we can go it alone because we are able to do so. But what it did also show is serious flaws in federal systems. And it's a question of not saying this is federalism, it's the problem, conceptually or even constitutionally, but how they operated as a system. And here we see, I think, more emphasis should be placed on the soft side of federalism, the dynamics of it, as opposed to institutional design. And in the book on COVID and comparative federalism, I tried to develop this notion of the comorbidities in federal systems, where the system itself fails to provide. And we see it, lack of clarity in division of powers, the lack of cooperation. It's a theme that has gone through, but so vital in many countries that, in fact, it's a serious comorbidity. When there were no new ones emerged, where they were poorly functioning, they became dormant, and the absence of these structures had a serious toll. The other element clearly is also capacity, which were raised both at the federal level, federal government level, which Eva Maria, national government level. So COVID, they really put the spot on who can deal with this multifaceted, the COVID pandemic. If we look at future research, what do we make about it? We had some very interesting list of topics that should be dealt with. Let me just say first, and I repeat what everyone else have said, this is not the first and last pandemic or crisis in governance. We were shocked because it was so long in duration, so severe, the consequences were severe, but as I said, next one could be climate change. So this really forces the academic community to seriously look at what can we learn. But then one must emphasize is, so there's an urgency to research. Secondly is we have not seen the end of COVID. We're still really in the beginning stages of finding out what has been the impact on the economy, on social life, and our governance plays into it. And then, of course, we'll have to look seriously at the comorbidities that existed in a number of federations. Look at those where there were health factors that were good. Why is that? Is it political culture? Is it a federal culture? Is it a greater public democracy? What made that some federations function better? Why were there serious comorbidities in others? The other point I would think that we should research is that all levels of government were involved in the battle against COVID. Not only the federal and state level, but also local government. And that the local government element has been a bit, though they were not making policies, they were the institutions that looked after the vulnerable that were falling through the cracks. And one should, in fact, pay attention to those and to see also in the future, when there's another different pandemic or crisis, how do you govern collectively, collaboratively at all three levels? Then perhaps to, but so in conclude on that was just is to say that federalism is not seen as the scapegoat. It has a lot of positive aspects. It has also focused people's attention in many countries about the ability to differentiate and deal proportionately with measures, which entail territorial divisions, the devolution of powers. So I think in the end, my view is that federalism may have come out stronger than before. Last point is, I think Eva Maria's point is very, very poignantly made, is about the inequality in countries, how that affected people with COVID, South America, Africa. We compete for the most unequal societies. And then on the global picture, we see exactly the same. And outcry. How come that there isn't a much more global view, global federalism? There was the beginning stirrings of in G7 and other bodies about how do you distribute vaccines across. The important area of research, how can you make a much more globalized way of dealing with pandemics in the future? So that's my few comments. Thank you very much.
Thank you very much, Nico, for drawing out and emphasizing some of the key questions, issues we've discussed in this webinar, which I think we as Forum and you as researchers and as ICFS will continue to discuss further to see what we can do jointly to address some of these themes. I think we need some more time to reflect, but for me, and I think I also speak for my colleagues, it was very interesting to have this reflection and this interaction. And obviously, it would be nice to do this not just in a Zoom room and electronically, but in person. But as we said, we're still in the pandemic, which hopefully will be over at some point. But yeah, let's take this as a positive note, and I would like to conclude this event by thanking, of course, our co-host, ICFS, and Francesco Palermo, all of you panelists for taking time and preparing for this, for your interventions. Nico, of course, for diligently listening and summarizing. And then also, of course, my colleagues, Diana Chabanova, John Light, Liam Whittington, and Simon Clark, who's helped us put this all together. And thank you very much to the audience for posing your questions, hoping that you also found this useful and interesting for your future work. Thank you very much and have a great day. Stay healthy. Bye-bye.